Hello and namaskar. Welcome to this episode of AUMHUM Talks. Today, our guest is renowned, in fact, well renowned psychiatrist and psychotherapy trainer, Dr. Nitin Shukla. Dr. Nitin has a rare distinction of being one of the very few psychiatrists to be a practitioner, a trainer, an accredited faculty, as well as a supervisor of psychotherapy. He has won multiple awards and has been recognized for the best psychotherapy of the year. We are thrilled to have him here, and he is here to share his insights on trauma, its impact, and the ways to heal. Dr. Nitin, welcome to AUMHUM Talks.
Thank you so much. Thank you for the kind words.
And joining me today in the show, as usual, would be my colleague Soumya Singh. And
Hello.
to start
Hi.
with, I would want to understand this word trauma. It always makes me think of extreme situations. In fact, in my hometown, there's a medical college which has a trauma center. So, am I getting trauma correctly, or is it not what I'm understanding from the popular lingo?
Yes. So I think I'll begin by saying that traditionally, when we say psychological trauma, the concept of trauma, and if you connect it to post-traumatic stress disorder, came from one single trauma, but that was defined as a trauma because it was a very unusual event or it was a life-threatening event. So, for example, if I have a small accident, now that's not very usual for everyone, but it is not unusual either. However, if I have an accident with a truck, now that is not a usual thing. Or I have an accident where I am admitted to the ICU for a longer time, or I'm in the hospital. During that time, I would have experienced fear of my life, that I'm going to die. So the worst possible consequences were there, and those things were called trauma. And as research into this progressed, it literally started from, I mean, if you talk about the so-called developed world, it started from World War One. World War Two was where it was researched much more. Then came things like Vietnam, where it became even more prominent. So what used to be called shell shock became post-traumatic stress disorder. More research started into it. And then there was a very seminal study called the ACEs study, or Adverse Childhood Event study, and that brought in a new definition or expanded the definition to something much broader. For example, so it need not be life-threatening, but if something is small yet repeated, for example, I go to school and I face bullying. It is not killing me. We see that bullying can happen in schools. But if I experience it as inescapable and it just goes on and on and on, its impact can be as bad or even worse than having a life-threatening accident.
Yeah.
So if somebody is really looking for the definition of trauma, I think the ACEs study would be a very good thing to begin to understand what all things can be defined as trauma.
So, does it apply to anybody who thinks he has been through a trauma? Or a lot of us are living a life where we are not even aware that our personality or character or traits are shaped by certain trauma that we are not aware of?
I think mental health as such is pretty young if we talk about the awareness that we have. So I'll give you an example, which I sometimes give the young people that I work with. I ask them, what are the symptoms of diabetes? Now everybody knows what is diabetes. But 50 years ago, how many people knew about it?
True.
And there was a time, and I can remember that, where its symptoms are something called polydipsia, polyphagia, polyuria, which means the person eats too much, and they're eating too much because they have a lot of sugar in the blood, but the blood is not going into the cells, so they feel hungry. They drink a lot of water because the blood has become more viscous, and because they're drinking a lot of water, obviously they go and urinate multiple times. So polyuria is urinating a lot, polydipsia drinking a lot of water, polyphagia is eating a lot of food. Now, at that symptom level, if 50 years ago a GP was telling a person, well, you have diabetes mellitus, the family would turn around and say, you must be crazy. This person just keeps eating, therefore they feel that they need to drink water, and because they drink so much water they have to go and urinate. This is not an illness. So recognition of symptoms and then going down to the pathology level, that takes time. In mental health, awareness is increasing about the symptoms, but the symptoms may mimic real life. Hence, a lot of people feel this is normal. You feel anxiety? What's the big deal? Everybody feels anxiety. But they don't realize that I am feeling an anxiety equal to somebody putting a gun on my head. It's not just facing a simple exam. So awareness is beginning, and real awareness will happen when we start to understand the underlying mechanisms of it, which is again slower in psychiatry because of multiple reasons.
Uh, so after someone experiences a traumatic event or has experienced some trauma, there would be different responses to it. There could be psychological, physical responses. So can you tell us a bit about that? Like, what are the psychological responses that one can look out for, or the physical responses that are evident that someone has gone through a trauma?
So what I will do is I will encourage everybody, including the listeners and viewers, to go to the right source when we look at definition of certain terms. So when we're talking about what are the psychological effects of trauma, if I open the internet, I will get thousands of people writing articles. So I would encourage two sources. One of them is called ICD, which is International Classification of Disease, and that's by WHO. And then the other is DSM, or Diagnostic and Statistical Manual, which is more used in USA but now widely around the world. So if I look at those definitions, then what are the physiological symptoms? What are the psychological symptoms? So let me give you an example. What if you put a gun to my head? What am I going to experience? All those things will be the physiological. So let me ask you, you put a gun to my head, what do you think will be happening to my body? How will will my forehead be dry, or will I be sweating?
Yeah, your heartbeat would be faster. Uh, you would be more vigilant of what is happening,
Yes.
uh, uh, and shortness of breath could be there. Uh, yeah, I mean, more symptoms. Uh, I mean, I can define anxiety symptoms in general. There would be a lot of anxiety and thoughts of uncertainty.
Yes. So again, if somebody says what are the symptoms of anxiety, then we look at neurologically they were defined as symptoms of autonomic arousal. My body is aroused. The automatic nervous system. Automatic because when you put a gun to my head, I don't have to tell my heart, okay, start beating faster. Muscles will become tense by themselves. Heart will start to beat faster by itself. Blood pressure will rise. It'll go through the roof. My breathing will become shallow and fast. My stomach, it'll not be very relaxed. I'll be wanting to rush to the loo. And so this is happening in my body. I'm just thinking, should I tell you all those symptoms? Or I'll just give these examples. But if somebody reads the symptoms of autonomic arousal, they will get a list of those symptoms. So physiological is what my body is experiencing, and psychological is thought, emotion, action, or TEA. What will I be thinking? So you put a gun to my head, what will I be thinking?
If you ask me, I'll go blank right then.
Yes. So mind going blank is one of the symptoms.
And then there is a feeling of I was in a flow, I was in a harmonious state in general. Now there is something new that I need to immediately respond to. So uh, physically, I can see I would sweat immediately. But then why? Oh, how? What do I do now? So there is that blankness, and probably I'll either respond uh, in retaliation in some way to make myself safe or secure, right? Or try to find a way out of it. Now that itself happens later, right?
Yeah.
Yeah.
So, it'll help to start to now give, because by the end of this discussion, if whoever is watching it can take some points. So I'll try to simplify things, and I'll use the whiteboard just because it's the traditional way, but it also works well. Behaviorally, one of the simple and older ways of defining things was that when there is a threat, then I'll go into fight, flight, or freeze. And then that connects to, on a long term in my life, um, when difficulties come, do I freeze? My mind is racing, my mind does not want me to freeze, but it's going into that freeze because probably when I was experiencing trauma at that time, freeze was the best option. So I'm getting shouted on by my father every day, beaten by him, and I'm facing that humiliation. Can I fight my father? I'm a small boy.
No,
Can I leave my home and run away?
not possible.
So if I don't have these options, I freeze. And when I freeze, that the body basically learns that this out of the options, this was what helped me survive. Now in future, my boss raises his voice at me, and I don't want to freeze, but I freeze.
Yeah,
My wife is angry with me.
Yeah,
I freeze.
that's very relatable. I mean, I can as a team leader, I can clearly see how. I mean, I can see these patterns, and even in interpersonal relationships, I can see that. That's very beautiful. I mean, I never knew that because traditionally we've been told it's a fight or a flight response in general to a situation.
So this is an example how my childhood experience, whatever helped me survive, is now becoming my unconscious mechanism. That's my default. So you can look at it like this, that the program got written here. And all I do is keep running that program again and again. Now I don't know how to change that program by myself. Not because I'm not intelligent, but because I can be the best surgeon in the world. Can I operate on myself? And there comes the role of therapist, friend, anybody who can listen to me comfortably in a relaxed state instead of shouting and screaming at me. And many times we shout and scream at people we love. Why are you behaving this way? Why do you freeze? Why are you becoming quiet every time? And when they say that, I'm becoming even more quiet.
Yeah.
So in a sort of IT language, program has been written. I'm running it again and again and again. Therapy is update of this program.
being aware that such a program is running through someone, or let's say through me or anybody else, is that like a first step, or it doesn't solve it? The awareness alone doesn't do it. Clearly it doesn't. But does it have any use? Because if there's a pattern and it's repeating again and again, I may be aware it's there, but nothing changes.
Yes. So in therapy, I talk about sort of three A's, and I'm trying to keep things simple and relatable, just like this example. So the A you're talking about is we talk about awareness. And awareness is of two kinds. One is we use the term awareness in education about something, information about something. But if you look at it from the therapeutic perspective, or let's say mindfulness or the Buddhist approaches, then awareness is being able to sit with it. Being aware that I'm afraid, just being aware. Now, that is the beginning. It's not just information, because there's no dearth of information these days. Internet is full of it. Then comes acceptance. So you can say, Nitin, I think you're becoming overweight. And I'm like, no, I'm not overweight. I'm just a bit chubby. I'm just heavily built. My father was like this, my mother was like this. I'm running away from accepting it. If I do that, I will keep rebounding to the level of awareness. Some people are not even aware, but I will stay in this loop. The last is adaptation or change. This will happen once I accept, only then will I move towards adaptation. So that's one of the key issues. And why don't we accept certain things? Because we are worried about, if I accept, then something bad will happen. So if I accept I am afraid, if I accept I have a problem, what will people think of me? People will see me as weak. People will see me as incapable. I'm supposed to be the head of the family. I'm supposed to be a CEO. So this is a lot of in psychological therapy. And if we look at the example like I gave, if I don't accept that I am overweight, or if you say, Nitin, I think you're drinking too much. Oh, no, no. So unless I accept, adaptation does not happen. So that's a sort of a longer response to your question about awareness.
Yeah, so a lot of times people who have experienced some sort of trauma tend to keep on repeating that same pattern over and over again. Like they would end up in similar relationships. So, is this where the person is not accepting, or they have lack of awareness? Like, where are they stuck that they keep on repeating those patterns?
Like I said, look at it like a program.
Mhm.
As long as I'm using word program, I can put any content, good, bad, but it's the same format.
Yeah.
So I will keep repeating because the program is the same.
Mhm.
If I froze, I'll keep freezing.
Yeah.
If I was able to fight, and so my father was beating me all the time, and I thought, okay, let me humiliate him in public. And if I do that, he'll become afraid of me and he'll stop doing it. So I thought, oh, this is a great way. Just keep humiliating people, keep putting people down. So now that has become my program. I'm meeting and God forbid if I reach a higher position, because then I have a right to put people down. And part of me is just enjoying it, not consciously,
Mhm.
uh, but that's become my program.
Mhm. So, in a way that is making the person feel safe, like because
Yes,
they are in
look at it
survival.
like, yes, what helped them to survive?
Yeah.
Hiding helped me to survive, I'll do that. Fighting helped me to survive, I will do that. Shouting, screaming helped me to survive, I'll do that. Completely becoming passive, quiet, I'll listen to everything that you say. If that helped me survive, I'll become that.
Yeah. So there are we can call these behavioral manifestations of trauma. Are there some very evident behavioral manifestations, such as, like, is people pleasing also a behavioral manifestation of trauma, or I mean, there could be other reasons of someone being a people pleaser?
So please remember that in mental health or the mental world of people, we don't have the luxury of mathematical ease of this leads exactly to this and only to this. Mind is algebra. A plus B minus C divided by x cube, and as you change slightly each variable, the outcome changes very significantly.
Mhm.
So if you look at it like that, then it we need to ask, could it be a manifestation of trauma? It can certainly be a manifestation of trauma. It could be certain other things also.
Yeah.
So, but if you relate to it that while I was undergoing trauma, um, that's what I found helpful. If I please my father, then things are fine. If I
Yes.
please my teacher, then they will give more attention to me and they will listen to me when I complain about bullying. But if I don't please my teacher, then I get bullied and I tell the teacher will say get lost. So how these things are shaping is like the algebra of life. That's shaped me. So people pleasing can be. If I, again, to see what are the key thinking related, and I'm going back to thinking because when we say thought leads to emotion leads to action, and I use these words also because it's a simple acronym of TEA. What are the thoughts or the core beliefs that I begin to develop when I experience trauma? I think that's worth discussing. One of them is safety and trust. So when I am a child, I am supposed to be protected by my parents, or let's say protected by my siblings. But if I face physical abuse, emotional abuse, and sometimes horribly sexual abuse, then if I can't trust my parents, who can I trust? So now my safety has become the core of something which is constantly threatened. Whatever happens, I will start to associate it with safety. And because I'm also a teacher, I can't help but write things in acronyms also. So if you look at SCORE, safety and trust, that's one big theme. And I look at how it will manifest in my emotions and in behavior, actions. Control or choice. I don't have any control over things. So I give up a sense of control. I stop controlling things. I stop. You ask me, what will you have for dinner? It's not that question, but you go to the restaurant and you say, what will you have? Anything. Now that's a small example. That doesn't mean anything bad. But if I extend that anything, I'm not particular about anything. I'm not making any choices to other things in life. Who do you want to get married to? Anyone. What profession are you really passionate about? Anything which will give me money. So it starts to, you can see how these things start to move forward. If I have a sense of loss of control or choice. And the last is that you feel, I'm forgetting this another thing, but there are certain key categories which, if we understand them, they are the, how can I say, when you look at a tree, there are thousands of leaves, But if you can get to the main root of things, you will understand things much better. So at the root are things like this.
There are a lot of questions that are coming to my mind. I find it extremely interesting. More from my, I would say, I don't know, I should call it experience, but my interaction with meditation, mindfulness. Uh, there are two things that specifically I want to ask on this. Like when the safety of me, right? I'm working on that all my life as this program that's going on, which is helping me do that, even when it's not needed. It's what is that me? What am I securing? What all? Right? Is it the body? What's that identity structure? Right? What all can it be? Because as you were saying, I mean, I might be securing a lot of things that I identify with, but there must be some boundary in general, right? Where does it lie in this boundary of me, the one that I'm trying to secure with this program that's running?
So the thing is, it can spread, and the more severe it is, it's like how much you're watering a plant, that much its roots will spread. If I'm a little afraid, then I'm focused on my own safety. If it's even more intense, then I'm worried about safety of my family, constantly worried about the safety of my family. You would have seen brother and sister of the same family, now they've become parents. One of them is very, very concerned. Oh, my son is 10 minutes late. The other person is saying 10 minutes late in today's world is nothing. So, how unsafe is the world to me? Probably another helpful way to look at it is, I'm constantly thinking about self, others, or the environment that I'm in, and future. And I'm categorizing this because it becomes helpful. We have so many thoughts. I am unsafe. If I am unsafe, then how are others? If I'm the victim, then they are the victimizers. If I am unsafe, the world is threatening place, dangerous place. So you can see how it shapes my entire view of the world. Because the moment I become unsafe, there has to be something which is victimizing me, threatening me, and then the world ultimately generalizes to the world. People are generally not nice. World is an unsafe place. You can't trust anybody. You should always do this. You should never do this. You should always do this. Future is unpredictable. You can't have enough bank balance. You need to do more. So how me feeling unsafe and cannot trust the world has now changed my worldview and how I work towards the future.
Yeah, so I wanted to understand more on complex trauma. So, whatever we discussed till now, I see a lot of similarity between someone who has experienced a traumatic event and someone who has had. First of all, I mean, I want more clarity on what exactly complex trauma is, and then how do I differentiate? Do I need to differentiate between the two? Uh, and if yes, then how do I do that?
And when you say you mean whom?
I'm uh, as a therapist, or as someone who wants to know more of about trauma, someone. Yeah.
Yes. So, again, looking at the history of how trauma was studied, first, life threatening, exceptionally stressful events were being studied. Then it was realized that repeated it was called the small t trauma. So, the small t means that others will say, this is usual, this is nothing unusual. It became a problem because it was just repetitive, being shouted on every day, not just one day. because everybody gets shouted on one day, being bullied every day, emotional neglect by parents every day. So those kind of repetitive started, we call the adverse childhood experiences. Complex was, and just to add, adverse childhood experiences also included, like if I lose a parent. So if I lose a parent, on one hand, so many people have lost a parent. But on the other hand, it has lifelong consequences. And just again to go back to that study, because it's a very seminal and it categorizes things. If I tick on more than three or four of the adverse childhood event experiences in my life, it is predictive of not just my psychological well-being, but whether how bad I can get addicted and even medical diseases. So that stress is not just affecting my mind, it is affecting the entire outcome of my life, etc. Now coming to complex trauma. Complex is not something which has been defined in ICD or DSM. However, we are moving towards that. Complex is something which is repeated and unescapable. So I cannot flight. I'm just stuck there in that environment. I'm in a foster home. Whatever is happening, unescapable. So that is even more damaging because the way it makes me think and the effects on my physiology. Now we are understanding that it even affects my brain development. Because the brain will become an expert of what it gets faced with. So emotion is emotion. If I'm happy, I become an expert of happiness. If I'm too anxious all the time, I become an expert of being anxious or an expert of being angry. Those kind of responses which are happening inside me and the survival which I need from repeated unescapable trauma shape my brain in a way where it affects the physiology, how I think, how I view the world, much more stronger. So that's complex, repeated unescapable.
Uh, so, how does one uh, help someone who has experienced complex trauma? Like, if uh, you mentioned about the awareness, acceptance, and adaptation part. When What I feel is that when someone has experienced complex trauma, they are usually either too aware, self-aware, but they just lack the acceptance, or they are not even able to make the awareness, because we are told that certain things are, they it is what it is, or it is what it was, and that is why they just can't even reach the part of awareness. So how can someone help, uh, start helping themselves, or as a therapist, how can I help someone facilitate their journey?
Yeah. See, I think I need to highlight two things. One is we seem to approach physical and mental illnesses separately, differently. Somewhere the assumption is my mind is me and I should completely be in control of it, and hence, if I have a problem to do with my mind, I should be able to manage it myself. Like, how many people are right now recording webinars about how to control my thyroid problems by myself, how to treat my hypertension, my diabetes by myself? We are not having that conversations because we can see it's been clearly defined. The best person is, and the easiest thing is to go to a professional, get work done. And like I had said that proverb that the best version of the world can't operate on themselves. You might be able to help 10 people with anger, But when it comes to yourself, somehow we are not able to apply those things to ourselves. And you sit with somebody, not necessarily a therapist, but a therapist has the advantage of being unbiased, trained in that field. That allows you an opportunity to be able to work much more efficiently than trying to do it just by yourself, or trying to do it with somebody who you really know very well. You think knowing a person well will be helpful, but that creates a bias and challenges. So professional help would be one thing. And yes, people will say, so should I just go to a psychiatrist for that? Should I just go to a psychologist for that? The answer is clear yes. If you want, like there was if you have a teeth problem, what do? You go to a dentist. Um, so it's that's where what is called the stigma associated and the beliefs associated. Belief, like I said, it's my mind, so I should be able to sort it out by myself. It's like saying it's my car, so I should be able to repair it by myself. It's my house, so all I should be the electrician for everything. Doesn't work. And the second thing is stigma. What will people say? First of all, that I am seeking help. I am supposed to be a well-educated doctor. I'm supposed to be a great CEO. I'm supposed to be this and that. So there is a shame in being able to seek help. Again, professional is good because you're meeting somebody who doesn't know you. They're not. So that's what I would suggest. It would be the most efficient thing. If you have concerns about meeting a psychiatrist, go to a psychologist, and best would be clinical psychologists because they work in clinical areas. They have seen people with these problems.
Uh, One question that always comes to my mind in such a scenario is that if I have to look for somebody to help me in such a case, right? So, as you were saying, if I have a tooth problem, I'll go to a dentist. It's very clearly defined for me. I can see that people who are having tooth problem, their problems look similar to mine, right? So they're not very different between different patients. There is a semblance, but when it comes to mental health, if I go to a psychiatrist, I see people of all kinds. So, which means it's more like a catch all, as we call it in technology, that you know what, anything to do with mind, it's like a GP of mind. But if I have to work on my trauma and I don't see other people relatable out there, or in fact, if I end up hearing a psychologist for that matter in a session talking to a patient, right, who is not relatable to my the disease itself is not that closely related, right? Uh, it it shakes me up a bit. It feels like I'm going to a more of a generalist, and the confidence in the trauma therapy or treatment, right? I miss that out. So, are there specialists like these, or if not, then what could be a method that anybody can follow, right? A good way to find the right person to go ahead
Yes. So, um, see, when we see is there a specialist, psychiatrist in itself is a specialist, and so your question is actually is there a super specialist in psychiatry? Super specialization in trauma has not yet started. So I would say that people who have more of an interest and reputation in that area would probably be better. So if I'm known to treat, let's say, I'm a psychologist who works very well with marital problems. There's no specific degree in marital clinical psychology, so that would be my practical recommendation. Uh, Check with people wherever you have good reviews, and word of mouth is more relatable and trusted than online searches. So these two things, I think we need to normalize it also. What I mean by that is, even when the problem is well defined and I go to a dentist, I will check to see that I go to a good dentist. And let's let's be very open and honest that um, if I get 10 plumbers coming to my home, all 10 are not going to be the best. I will probably think 2 or 3 will be really, really good. Probably the same stands for doctors, psychologists. So give a try. And personal relationship is very important. Let's say I'm a psychotherapist and I worked very well for one person, they gave you great reviews. You went and met me and you thought, this person is weird, I don't even like him. Please value that, because I can be a very ill behaved doctor, but if I give you the right medicine, it will work. As a psychologist, that needs to work. And I'm not just saying as a opinion. This is a clear investigation and research, which not investigation, research has clearly shown about 20 years ago, it was that I need a specific kind of therapy. So if I have trauma, I need, or I have personality, I need DBT instead of CBT. I need this specific kind of therapy. As research progressed, it has become clear most of the therapies have similar efficacy. The strongest variable is actually the therapist. And it sort of makes sense. Same book being taught by 10 teachers. The biggest variable is the teacher.
It's a very
Same book being taught to all students.
Yeah.
The biggest variable is actually the student. So once we realize the human element is so important in that, we will spend a little more time. And if we don't not satisfied with one person, we go to the next. That is our responsibility. And let's take that responsibility. We will be happier rather than we go to one, this didn't work, so next 20 years I will not meet anybody. Because 20 years ago I went to somebody and it was not helpful.
I have two questions from my team members which have come on this topic and the one you had just picked up just before. One is about, is there a term like trauma-informed therapists? We keep hearing that.
Trauma-informed therapy?
Yeah. What is
trauma-informed therapy? So trauma-informed means that I am not, this discussion today is entirely trauma-informed. That I am aware of trauma. I am not only looking at a person returning from war as a PTSD. It's not just John Rambo who's coming with PTSD. But day to day, all of us are exposed to emotional trauma, which, if repeated, even small, can have lifelong consequences. It will not kill me, even though we realize that it's. So, coming back to the question, it will not kill me, but it will impair the quality of my life. Most important, relationships. I can be a great CEO, it will not stop me from doing that. But how happy I am inside my home, not the size of the home, but the quality of what happens inside will be significantly impacted by that. So that's trauma informed. I understand the scope of range of trauma. It's a spectrum. The word spectrum means everybody experiences it. It only differs in severity. The second is, so to look at it like a spectrum. The second is when I see people's responses, rather than just understanding what's happening today. Today you're afraid of your boss, let's just work on you and your boss. A trauma informed will also look at where did this programming happen. So that's trauma informed. So what's happening is we are encouraging people to be more and more trauma informed by people who are existing therapists. We are doing regular work with them to make them aware of what we are making you aware of. As they become aware, they become more sensitive and understanding of things and better treatment.
Yes. There's another question that I have received, so I just want to put it out. Child sexual abuse victims, them refusing or deciding not to have kids. This is also some sort of a complex trauma response. It certainly can be. I mean, with some confidence, we can say that, right? So, if I statistically, what I understood is that it's not simple mathematics. So it's very much like statistics is how I how I see. So there's a confidence level in every answer.
So it's so in research language, this is called a case report. Case report means like if I tell you, oh, once I heard a person who drank so much milk that they died, let's say, or we know there's something called alcohol poisoning. You can drink so much alcohol, you can die. But that's not representative of everybody who drinks alcohol. That's not representative of everybody who drinks milk. So a case report can be used to highlight any extreme. I can give you a case report of somebody drinking water and dying and somebody drinking water and their cancer being cured. So they can highlight extremes. So I'm careful when responding to things which are more like case reports. It exists, but I can't definitely give you a clear answer as to how much. And yeah,
fair.
In terms of understanding trauma a little bit more, I have one more question. That usually trauma is seen as a negative experience in it, that it has negative consequences. But is there a possibility that uh, a person could experience a positive transformation because as a result of the traumatic experience? So can yeah.
now there is a concept of post-traumatic growth, not just post-traumatic stress disorder, but post-traumatic growth. The unfortunate thing about all positive things when it comes to study is that medicine, including psychiatry, has been more problem focused. So we have more PhDs on trauma and its problems than post traumatic growth. So the data is limited. It exists, it is a very, very important element. Eyes will not see what the mind does not know. If as a doctor I only have a problem orientation, I will see it completely as black or white, completely bad, trauma only causes symptoms, only causes problems, eliminate it, kill it, fight it. But there are two sides to the coin. So post traumatic growth, how can challenges make us stronger? So challenge is like a wall. I can either run and collide into it, fall down, especially if it's too big, or I can somehow learn to jump over it. And if I collide with it and I still somehow by myself with the help of people, something I'm able to jump over it, it actually increases my confidence level to something else. So what is called stress, and we've heard of stress inoculation, deliberately exposing people to stress. In Japan and certain schools where lots of air conditioned everywhere, they were not being exposed to natural circumstances. So they deliberately started to strip them down to underwears and have them run through a place with lots of ice. Um, um, Here in Australia, and I've heard in US also, it could be raining, it could be really cold, but my daughter will go for her netball. They'll be in cold rain, they will be playing because that's natural. So you can say playing in cold rain, you ask a general parent, they'll say, oh, no, I'm not going outside, I'm not sending my kids outside. But doing that builds their immunity and resistance. So I'm trying to extend from a simple concept to what is called trauma. Can bullying lead me to something positive? Possibly yes. I was not standing up for myself. Bullying forced me that I have to stand up for myself. We've heard of Ajit Doval, who's our security head in India. He speaks about how he was bullied and how it positively influenced his life. There are lots and lots of big celebrities who have spoken about trauma and how it shaped their life. If you look at athletes, if you look at a lot of people, they're not coming from some big background. Most of them are from very humble, difficult backgrounds. Like this young person who's been a runner from Odisha or West Bengal. She was sort of facing so many challenges. Running was her way of coping with it and being a world champion. So these are examples of how post-traumatic growth happens. As a therapist, what I need to understand is be aware that there are two sides to the coin. As I begin to elicit that I can understand this has been really difficult for you, but what exactly did it do for you? Did it make you stronger, better in some way? And you'll be surprised how people begin to speak about that.
Interesting. And this is not a zero-sum game, right? It's not like there is a equilibrium self which would have got disturbed because of trauma. So something shaped really well. Somebody became a runner, somebody became an Ajit Doval, right? Something else, it's not that something else in their persona might have taken a hit. We are not looking at a world like that. There is no such relationship that exists. Is that so?
Yes, it's more professional to be open and uncertain about these things rather than be very closed or form a very strict view. It is only good, it is only bad. There are two sides, and ultimately, if you look at it, the first role of a therapist is to assist us to move from whatever we call negative to what we call positive. But a longer term goal is to be able to transcend that, both the negative and the positive. I'm worried about safety, I'm feeling unsafe. You help me to feel a bit more safe. Therapy goal achieved. But there's a higher therapy goal, which is if safety is still a concern to me, then there is something unsafe out there constantly. So I have to go beyond. I have to come to a point where I realize that I have been worried about feeling safe. My life is telling me that apart from childhood, things did turn out to be safe. But I'm still caught between the safe and unsafe. I have to transcend this because life is bigger than just safe or unsafe, and I cannot be preoccupied just with this. So that's to be able to do that, negative, positive recognition, and then transcending that.
Wonderful. Wonderful. I have a lot of questions coming to my mind on that, but for the paucity of time, we might have to move to the next segment. I mean, whatever you're saying, I'm getting theme from however, how much time I've spent on Osho. A lot of his approaches on exposure therapy, what we would call professionally, right? And many other threads are just coming in. You mentioned like therapy, it's more about the therapist when it comes to the efficacy of therapy, and that goes with Ayurveda. Ayurveda is all about the Vad and not what is being prescribed to you, and that's where we say, at least it's a popular norm, that it's not a degree that you hold in Ayurveda. It's not, that doesn't matter. It's the Vaidya who matters out there. But with that, I mean, I think, Soumya, we need to move to the next section, right? Yeah, sure. Yes. So we have two set of questions here that we have received. One is from our audience. We have a regular segment on that. So we'll try to pick up a few on those. And few are from our team members, basically therapists who are working with us. So they have a lot of queries, given that this is such an important topic, right? Soumya, you want to start with that? You want to pick up one of those? And you can start with the therapist questions first.
Okay. Yeah, so one of the questions is the most difficult thing when dealing with complex trauma is that the client often doesn't want to address a lot of issues or even acknowledge that certain behavior might be trauma response. How should one approach such a situation?
I think so. Psychologically, what you're describing is would be called either that I don't have insight, which means I'm not really aware of the connection of my past to all these problems, and hence I'm unable to think how will that help. The other word is resistance, that I'm resisting treatment. Like you, um, that there's a bee stuck inside your car, and you open the window and you want the bee to go escape, be free, but it's afraid, it's still going around there.
Yeah.
So look at it like that resistance is not them trying to, the word resistance needs to be changed to understand what are the person's goals. Sometimes as therapists we think, oh, this should be your goal or this is my goal.
Yeah.
But then the person comes with their goal. So what I say to my clients that I work, and currently I'm working more with 12-year-old to 25-year-old children who come to it's a public mental health service. So I tell them, I'm a waiter. You come to my restaurant. I will present the menu to you. Honestly, I will present you what is good. I'll suggest you what is the chef's special. But if you say, I don't want any of these, I just want water, so be it. It does not change our relationship. I'll not feel bad if you don't order, oh, I said chef special, you didn't order that. That was the best dish. Why did you not order that? You are completely free. So you work with resistance by, I think therapists can look at something called the motivational approach, where you roll with the resistance. Somebody says, I don't want to stop drinking. Therapist response can be, what do you mean you don't want to stop drinking? Look at your family, they are troubled by it, everybody's wanting you to stop. That's the traditional approach. But if I want to roll with that, then I say, well, thank you for at least talking to me about that. You're drinking one bottle, you could have been drinking 2 bottles, but you stop at 1. You could have chosen to come here and say, doctor, get lost. I don't want to talk to you. But you're kind enough to talk to me. So you begin very gentle, because they look at it in terms of they don't feel safe with people. They don't trust people. So rather than pushing, just saying, I am available here. So motivational interviewing approach will give you clear steps of how to go about this. And the extreme example would be working with people who had cancer. As a young doctor, when I would go there, they would look at me and say, look at you, fancy doctor, coming here to talk to us. Do you have any idea of what people face when they have cancer? And I'd be like, I can't even claim to say I understand. All I'm saying is I'm available if and when you want to talk to me. I'll come here, you tell me to get lost, it doesn't change the relationship, you have the right to do that. That builds safety and trust.
The same thing would apply to relationships also, right? If there are people who I care about, this very approach, the approach the therapist is taking over here, that I'm here. When it comes to parenting, we know what is good and what has worked, what works, what doesn't work, and we kind of try to force that on the kids, irrespective of however accommodating we try to become, right? With time, there are always internally we always know that okay, we maybe have judgments that this is not the right track. Knowing that, keeping that distance, right? As you shared, a relationship between a therapist and a patient is a very professional relationship. So, but when it comes to interpersonal relationships, there is always the baggage of expectations that this is how, even from care perspective, it feels like I care more for this person. It's not that I don't care. If I'm a therapist, I don't care for my patient, but looking at one's own kid or one's own brother or sister or whatever, a mother or a close relative, right? I would love to pick this approach over there, but then it feels that it it won't result in the right outcome, which of course is not in the control, or in my control, and it's clearly not what that other person wants. The one, as you were mentioning, that in case of a therapist and a patient, the guy wants a glass of water, so be it. Your role is to serve that, even if that is the case. How do we? I mean, because I would want to take this, have a takeaway from this on the interpersonal relationships, where I see this very applicable straight away. Right. So I would love to hear how can this relate to that?
See, even though it is algebra, human drama is very similar repetitive cycles. Ghar Ghar Ki Kahani. It's similar themes recurring everywhere. So I could speak a lot, but if I just stick to what we have discussed today, then one way could be, let's say if I just take this safety, control, choice, there's something else I had written it, responsibility, yeah, and connection. So safety, whether it's physical safety, psychological safety, financial safety, a lot of fights could be happening about safety. So if we start to look at the fight and we go back to where it is connected from, this is the action, we can see it, we can understand the emotion, but we are not aware of the thought where it's coming from. We keep assuming that. If we have a default where we start to assume that somewhere this person is concerned about safety. Example, financial safety. So I'm fighting with you. Why don't you work 6 days a week? Why do you work 5 days? Why are you spending so much of money? Who needs this big car? Okay, why are we spending so much on a holiday? So that's the fight. The emotion is anger, but the thought is there is a concern about safety. Or connection. I don't feel connected to you because I see that connection. I feel connection when we talk silly things, let's say. And we're all talking always very adult talk all the time. So I'm just a bit bored. Or responsibility. There are certain themes. So when we study trauma, I would encourage looking at these are called the core beliefs. And then we are all very, very intelligent. We just need to sit and think about it a bit. That will also be helpful. Trying to have some template here. But okay, is this person worried about safety? Are they worried about choice or connection? Are they worried about they are being held responsible for something? They feel responsibility is not being shared. In some time, you'll realize that ultimately the human drama is about 5, 6 things. Whether it's any way the individual affects interpersonal relationship, this is happening.
Yeah.
Beautiful. Soumya will go to the next question.
Yeah, so the next question is it always necessary to deal with the trauma in terms for a person to heal entirely?
Sorry, what?
Does one has to address the trauma or deal with the trauma so that they can progress in life? Like, can someone just not deal with the trauma and continue with their life as, I mean,
Yes.
without any issues?
Yes. Let's say depending on what works. So if being quiet works for me, somehow in my family, my parents are happy, my wife is happy, my children are happy with me being more quiet, it has worked well. Professionally also, people know ये चुप रहते हैं, quiet रहते हैं, but that's fine. So as long as certain behaviors are a little more socially accepted, especially flight or a bit of avoidance or freeze. Fight is less acceptable. again, it can lead to more professional success. If I'm Virat Kohli, and I don't know anything about his psychology, but I'm just taking an example. You made him angry, he will hit sixes. So anger is working for him. So if you make him angry, you're actually not doing any damage professionally. I don't know personal, I don't know whether he fights with his friends after that. But that's an important thing to recognize.
Yeah.
So anything which is working, it's utilizable, it's enjoyable. Comedians making fun of people all the time. Normally somebody makes fun of you, you get offended. But comedians get paid to do that. So that's an example. Whatever we have, if we are able to find a right venue for that, great, professionally. Interpersonally, it does create problems. And that's where people come for therapy.
Yeah.
That's where great achievers will come to you for therapy, because they are achieving a lot. But unfortunately, you see a 3-hour movie with fight is fine. You start to watch 24 hours that fight, it becomes too much. So people who are with them 24 hours.
Wonderful. We'll take the last question from the therapist. This one is, how can we help clients who have experienced complex trauma differentiate between their trauma response and their authentic self? For example, how do you guide someone in understanding that their hypervigilance is a trauma response and not a permanent part of who they are? That on that note, is our personality completely a mix of all the micro trauma responses? Is there something called an authentic self, as this my team member is asking?
Again, authentic self will be defined different by different people. So I have gradually stopped using definitions from book, and I will ask, whatever, if a person says I want to be my authentic self, I'll ask them, what would that look like? To somebody it might be very spiritual, to somebody it might be interpersonal, to somebody it might be just personal. How can we assess? See, first thing is, you have to understand, if a person is constantly hyper vigilant, trying to talk to them, change happens in stages. It's a process. It's not an event. Any constructive thing is a process. Unfortunately, destructive things can be an event. You can destroy a building in a minute. You cannot build it in a minute. So encouraging the person to think that constructive change is a process, and therapist also being kind to themselves, not jumping that from a person who is constantly hypervigilant, how will I sell this idea to them? No, hypervigilance is not you. And he's saying that's what I experience all the time.
That was a normal self for that person in some way.
Yes. So understanding the person, and sometimes we use metaphors, which is helpful. Metaphors simply means talking about something indirectly. Like the example let's say if I'm sitting with somebody who has a lot of hyperarousal, and I'll say that if I take this off, I can't see things clearly. So that's my experience, and I have to use this. But at the same time, while I acknowledge that, can I be aware that this doesn't mean my hand is not working, my shoulder is not working, my heart is not working, or my ears are not working? It's just the eye, and just a very small part of the eye, which is not adjusting well. So if I see myself as an identity, oh, look at Soumya, she's not wearing glasses, she's so smart. Look at Aviral, he will be thinking about me, I am a doctor. What kind of a stupid doctor am I that I can't take care of my health and I have to wear glasses? Just an example. The more I associate this with my identity, it overtakes my identity. But if I just say, okay, I'm traumatized, my hands are fine, everything below the neck is fine, it's one small part in the brain which is just being overactive. It allows me to sort of normalize, and that doesn't become overwhelming. So there are these small steps which help a person to move further till they now begin to engage with you. Then you work with them.
We'll move on to the audience questions. And Soumya, you want to start with the first question? We both have the list that has been shared.
Yeah, sure. So the first question from the audience comes from a 28-year-old female from Pune. I've read a lot about the need to forgive those who caused your trauma in order to heal. But I'm struggling with the idea of forgiveness. How am I supposed to forgive my abuser and why? Is forgiveness truly necessary to heal from trauma? How can I work towards healing without feeling pressured to forgive if I'm not ready or willing to do so?
Yep. See, first of all, don't allow anybody, whoever this person is, I'm talking to you directly, don't allow anybody to tell you this is necessary. Only if this happens, then that will happen. You can choose to not forgive and move forward also. Forgiveness is one of the tools. It is not the only tool. And you will only, and I hope, and I don't know how much forgiveness has been explained to you. You had too much of alcohol, you don't like to vomit, but you know it's best to vomit at that time. So when you tell somebody vomiting will help, it has two aspects. The word vomiting makes a person feel it's such a bad activity, it's a disgusting thing, I don't like that, even talking about it makes me feel bad. So how can such a disgusting bad thing be helpful? You will only know when you experience that. Only a person who has had too much to drink and has vomited after that knows that it actually helps. So that's the challenge. When people say mind does not accept that, it doesn't sound very reasonable. But at the same time, just be aware certain things which are called counterintuitive. Your intuition might be saying this is not okay, but if it has helped many others, it's worth thinking about. It's not necessary, but worth thinking about. I'll quickly explain sort of forgiveness, the four aspects of it.
Yeah. So there's a related part to it, supplementary to it, that can these victims, many times they think that they're not able to forgive themselves. Is that also part of the equation? And uh, it's a strong emotion.
Yep. So first is, this is for myself. I have, so there was this young person who we were discharging from the service. Parents were really angry because they were saying that there's nobody else who will be able to provide these sort of services. And we understand that, but we are able to fund a person as a government. You know, it's like you're admitted to the hospital, but at some point the hospital will discharge you. So they were very angry and they threatened me. Lots of things happened. So I know that's coming out of a good place of care. I was really pissed off after that. During the session, I was fine. After that, I was really angry. So if I just take that usual example and then I extend it to trauma, first is giving myself forgiveness. It's okay to be angry. I have permission. I give myself permission to be angry. I permit myself that when such things happen, it's okay to be angry. So, along with forgiveness, the word permission comes. I permit myself. I want to kill that person and I permit myself to have these thoughts that I really want to kill this person. and I forgive myself for having such thoughts. Asking forgiveness from myself, not just giving myself permission and forgiveness, but asking for, I am really sorry for what happened. And I'm asking forgiveness from myself to have just been in that situation where it happened. And what I'm speaking is a bit generic because I'm not sitting with the person, but I think that person will understand. Then comes, so this is within my control. Then comes the other person, giving them forgiveness and asking forgiveness from them. So the asking is also very, very difficult. And this is not happening in person. This sometimes happens mentally. And giving forgiveness only because it's like chewing gum in your hair. Uh, its nature is to stick. And that's how the other person's images, thoughts are sticking to you. You don't want that. You don't want to think of that person. How do you remove that emotional glue? Giving permission and forgiveness helps wash off that emotional glue, and that helps things to loosen up. So I'll give that example. But these are the four components. And because this is a sensitive topic, first I give people just a broad structure and I say, you think about it yourself. And when you wish to discuss this further, I'm available.
So in this, when the victim, so to say, or the person who's sharing, they say that I am having difficulty for forgiving myself, right? So how can I let this happen? And for that act, there is no forgiveness, right? So expression of that anger or not, no forgiveness for this itself could be very disastrous in some scenarios, right? I mean, some people, if they have too high a standard, we see this. There is this place in India called Kota, as you are aware, you might be, and this is slowly becoming kind of the teenage suicide capital for the country because people set up targets and they can't forgive themselves. Maybe I'm extending forgiveness to that, but somewhere the expression of the emotion is that how can I let this happen, right? So if it's okay to, and uh, and I can understand where it's coming from, acceptance of that emotion and not denying it, that okay, it's okay to not forgive, but that it has its own natural checks and balances, that such occurrence are a rarity, that suicides for that matter.
I have to take a balance between being very prescriptive that this is the right thing to do versus, again, back to that waiter example. I'm presenting you the menu. I'm presenting you the chef special. Think about it. Make your choice. Today you might just want water. Tomorrow you might just want a snack. Someday maybe it'll take 5 years for you to try to order that chef special. So be it.
Yeah, perfect. We'll move on to the next question. This one is from,
I'll add, because this is an important concept. It's a very big, very deep core thing. But if I don't forgive myself, then in a way, I don't have a right to exist. I am unforgivable. My existence is unforgivable, not right. It's extreme. And similarly, the other person should not exist. That's the end of anger. Now, unfortunately, the other person exists, or they've died, but there's been no closure, and I also exist. So this creates such a strong push and pull of an extreme where I exist, but I can't forgive myself. And unforgiveness means that I should be no more. So if you look at it, these things are so powerful in themselves that they split a person, creating huge amounts of conflict. Hence, again, the importance of what happened was really bad, but how worthy is it of losing my sleep every single night? Is it worth that? Is it worth being preoccupied with that all the time? Is that person even worthy of that?
Yeah.
So then it goes to the paradox of letting them exist because they're not important to me. And trying to not have their existence actually makes them so important. But big topic, best would be to be able to sit with this person and take it as long as it does.
This is a very good starter on that front, is how I see it.
I'm sure this was a very helpful. I mean, this would have been. This is a very helpful thing that it would help them a lot. They were, if discussed. Yeah.
I'll go to the next question. This one is from Raipur in Chhattisgarh. Uh, Growing up, I witnessed a lot of domestic violence in my home. Now, as an adult, I'm terrified of turning out like my father. Sometimes I see flashes of his anger in myself and it scares me. Every time I lose my temper, I panic. How can I ensure that I don't repeat those patterns? What can I do to break the cycle and become the kind of parent and the person I really want to be? Ensuring that I provide loving, safe environment for my children. It's a 30 plus year old person from Raipur.
Um, a few things come to my mind. One is it's sort of a paradox that the person who is most afraid of failing, or he talks about failing a lot, is actually the topper of the class.
Yeah.
Something tells me that this person is already going in the right direction, but they are afraid of even a little bit of that anger which comes. So it's like you're already scoring 90%, you're already going in the right direction, you are being a good parent, but you are afraid of that 10% because you want 0% of that. I would say it's okay to have that 10%. You do need to be angry at times, don't lose that. Dad was angry, that was bad, hence I should be not angry. Both these are illusions. It's not a 0 1, it will be an analog, less or more. So as long as you are much more comfortable, supportive, etc., and much less angry, you are already there. And so that's what I'm sensing from this question. I somehow hypothesize that you are already on the right way. Allow yourself, permit yourself to have that 10% anger, because that anger is useful.
So, uh, the kind of question this person has come up with, he doesn't. I mean, the risk of the abuse turning the abuser, right? That that case would apply mostly. I mean, in all probability, not here. Although, but that would happen when person is not really aware of this situation. Given that this person is aware,
Exactly.
that's the section back.
It's likely that this person is moving ahead, but somewhere you have labeled anger as completely unacceptable and you're trying to get it away from your life 100%. That's because that can't happen. You are designed to be angry because anger is important, it's helpful. Somebody messes with your family, it's better to have the choice to be angry than to have eliminated anger completely.
Yeah. This next one is from Bhopal. Uh, I've been using alcohol to cope up with the pain of my assaults for years. It started as a way to get through the nights, to dull the pain, but now it feels like I can't function without it. It has overtaken my life, my work, and my family. I feel like people see me as an alcoholic. but I can't do anything about it. I know it's not sustainable or healthy, but I don't know where to start or how to change. I am miserable. It's a 31-year-old person from Bhopal who has this question.
So what I would say is that somebody in your situation might be the opposite, and they might not even acknowledge it, not accept it, not want to change it. You are ticking all the boxes. You are aware of it. You're accepting and quite aware, and that tells me that it has had big consequences in your life. I'll step back into my medical doctor role for a minute. So back to that example, I'm facing assault, trauma, somebody put a gun to my head. The hyper arousal, the anxiety is so high. People define it like they are holding on to a live wire. That's the level of. So what's the difference between hyper arousal, hyper vigilance, and normal, let's say, vigilance? So normal attention is I can focus on one thing. But what is hyper vigilance? Where, imagine I'm lost in the jungle at night, it's dark. Now my attention is not focused like a laser beam, but it is spread around like the rays of the sun. Any sight, any sound, any smell, I'll pick it up and I will interpret it as by default threatening, negative. That's vigilance. In a state of hypervigilance, everything is attacking you. There are multiple guns on your head. The anxiety is so much that you need something to calm it down, something called a central nervous system depressant. Alcohol is that. The most common comorbidity of PTSD and trauma is alcohol and drugs, which make us more sedated and bring down that feeling of holding on to a live wire. So what I would encourage you to do is look at two things here. One is alcohol. It's become independent. So first thing is protect your brain by taking multivitamins, vitamin B, tablets, injections, because alcohol damages it. So that's one thing I would recommend. There are anti-craving medicines, you take that. Work on alcohol, but realize that anxiety is what is feeding that. So you need good treatment of anxiety. Maybe I can send an email to Aviral and with certain points, and then you can forward it to this person. But I think, and I'm saying that not just because I'm a psychiatrist. I specialize in addiction psychiatry. I work in Australia's first dual diagnosis rehab in public sector, where people with mental illness and addiction come. Just treating addiction is like treating fever. I give you Panadol, paracetamol, ibuprofen. That's not enough unless I look at the antibiotic for the cause of it. Mostly you'll get only one treatment. So you need a psychiatrist. Most psychiatrists will be able to do it, to treat it well, and there's lots of hope. That's what I would like to assure you.
That's very useful. I'll forward the email, and I'll also connect the person directly, so that if they intend to, they have all these resources available. Thank you, Dr. Nitin. We'll go to the next question. Yeah. So there are two more questions we would want to take, and then we will wrap up the session with that. My wife had a very messy childhood and now struggles with the feeling of abandonment. Whenever we have disagreements, even if it's minor, she fears I'm going to leave her. Her insecurity and clinginess can be overwhelming at times. I love her deeply and want to support her, but I don't know how to make her feel more secure and valuable in our relationship. What can I do? This one is from Jaipur. This particular question from a person age 26.
So maybe I'll quickly tell you what happens in the brain and the mind. So let's say I have an elder brother who's beating me every day, or I am a young girl and I'm being sexually abused. Experience means emotion and the event, both happening together. If the emotions are really, really traumatic, very difficult, and I'm like, if I continue to feel this pain, I will die, then what the mind will do is it has this ability to dissociate event, emotion. So I'm going through that event. Now people are hitting me, abusing me physically, emotionally, or sexually, but I don't feel the emotion. I'm numbed out. That is a survival mechanism, dissociation. It allows me to go through things. And people will say I feel like a zombie because it's like I'm in a dream. Things are happening, I don't feel them. But that's an extreme example. But that's what happens. Now, when this happens, it's cause splitting of my points of view into very black and white. So I think extremes. I'm always 0 or 100. You are going to be the best boyfriend in the world, or you're going to leave me. Now we all go through these extremes, but this person lives in these extremes. So either they are completely with you, and if you don't pick up a call, they drop to a level of completely ignoring me, doesn't like me, abandoning me. Now this is part of what we call a borderline personality structure, and I think a psychologist who can work with trauma can lead to PTSD, trauma can lead to borderline personality structure, and trauma can lead to substance use problems. These three are the main manifestations that you see at an individual level and of course interpersonal. Looks like this person is moving more towards the personality structure of thinking extreme, all or none. So a psychologist will be helpful.
Wonderful. Wonderful. I have one more question here. Soumya, do you have a question or I will pick this one?
I can take the question. Okay, so this question comes from a 26-year-old female from Delhi. She says, I've been dealing with trauma from a past abusive relationship for years, and sometimes it feels like I will never truly recover. There are moments when I feel like I'm making progress, but then a small issue sends me into a spiral of emotions where everything feels out of control. It makes me feel like I'm right back where I started. I'm filled with negative thoughts and mistrust of everyone around me. I know to some extent that I'm being irrational, but it's just so overpowering. Is it really possible to fully recover from trauma, or will it always be a part of me?
It will always be a part of you, just like any emotional experience is a part of us. That's how we are designed. The question is, it reminds me of, and I know this is a simple analogy, and simple analogies are probably not the best for very complex and severe situations, but it follows the same principle. That thing about one person meets his students and he draws a line in the sand and he says that you have to you cannot touch this line, but you have to make this line smaller. And we know what the students do. They try multiple ways, they touch the line, and he said, you can't touch the line. And then one of them or probably the guru himself draws a bigger line. Your past is that line, which you have the ability to draw a bigger line. Till the mind focuses on eliminating that line, it is paradoxically, the more you focus on it, the deeper it becomes. And again, paradoxically, as you are able to draw other lines in your life and as they start to become bigger, thankfully the brain, it's a dynamic thing. It's not the best way to look at it is it's a sea of cerebrospinal fluid in which there are these neurons swimming. They connect, they disconnect, they reconnect. As other things start to be more in your life, those pathways tend to become weaker. So drawing a bigger line rather than focusing on eliminating the other line, and the more you focus on having a bigger line, that's how the earlier trauma begins to change. So it is possible to recover. Good therapist would be really helpful. You might say, what if I can't get therapy? Well, I will again say you might be a great surgeon, you might be very intelligent. Working on ourselves just does not happen. That's the way of things. So let's accept it. If it sucks, it sucks. If you want to cry about it, be angry about it, please do that. But after that, please go and meet somebody. Recovery is absolutely possible.
On this question, there's something that comes to my mind. If someone's vocabulary has the term trauma a lot, doesn't it mean that they are focusing a lot on that line, the first line that the guru drew?
Yes, and that's because problem focus has been sort of the way of life. Like I said, if I am a child, from that time you come into the room, something is lying broken. What is the first thing you ask? Who broke it?
Yeah, you focus on.
So there's a finger pointing towards us. And I call it a paradox because we are in the vulnerable moment and the finger points towards us. You have an accident, ठीक से क्यों नहीं चलाते हो? You fall down, संभल के क्यों नहीं चलते हो? First of all, the person is already feeling bad. In that moment, whatever is said and done, that is what causes the programming. So now, moving on to the other very important point here in terms of use of language. I am unlikely to come to you, Aviral, and say, today I'm feeling a bit diabetic. Because we reserve the term for a specific thing. I won't come to you and say, I'm feeling like I have fever, unless I actually have fever. But with mental health, what has happened is the same words are used in normal day-to-day vocabulary. So if I'm feeling I'm sad, now that has started to be called I'm feeling depressed. Now, depressed is a terminology and a diagnosis. So the use of language has changed from saying I'm sad to saying I'm depressed. I'm stressed to I'm traumatized. I am burdened to I'm facing work burnout. So what that does is while it recognizes the problem, puts it into a good definition, it also then opens the door for me to then connect with the term of burnout and trauma, while what I may be feeling is just day-to-day sadness. So when a person is using the word trauma a lot, I don't know if it's become their vocabulary as with the younger generation, or it actually means they are traumatized. So I will always clarify. I'm always the waiter. I'll ask you what you want. I'll clarify the needs. Yeah.
This was a beautiful session. I know we didn't even notice the time. It just kept getting extended and extended. While whatever we say, words are not enough to thank you for this insightful session. We would love to have our viewers and our users have more and more access to you. Whenever time permits, whenever I know you have a very busy schedule, but personally, it's been very enriching session for me, and I'm sure for all my audience, my co-panelist Soumya, I would like to thank you for this session. To all our audience, wherever you are watching or listening to this podcast, do subscribe. I'll also be sharing more details on Dr. Nitin, and he is based in Australia. But as you know, location doesn't bound him. Whatever he says applies irrespective of wherever you are. So please connect and seek the help you need. If anything, and if you have any more questions, please drop in. We'll try to get back to you. Thank you. Thank you. Thank you very much.
Thank you. Thank you. Well.